Good evening, Professor Lang. My name's Erin Lambert, and I picked for my title of the informative speech is I Can't Sleep. I wanted to do this speech to inform the audience of different types of insomnia. We only learn of the word insomnia, but we don't really know what it means. The central idea for this whole speech is to stress how our life can contribute to our sleepless nights. Whether we have a stress-free life or a stressful life, no one is the same. We would assume that sleep would come pretty easy to an individual who works 12 or more hours, like myself, as of every other student, probably in Kaiser, and that goes to school, that works a full-time job, part-time job, PRN, whatever it may be. We work a lot, and we do a lot of school, and we have to do these things to move forward. A large amount of stress is responsible and sometimes can result in our sleepless nights. And that is how we would define it as insomnia. This topic is relevant to me because as a young 24-year-old, I'm doing what every other person that wants to have a career and pays their bills and lives independently as much as they can does. We go to work, we go to school, we juggle gym, health, we juggle family time if we have a boyfriend, a husband, or a wife. If we have children, right now for me, it's dealing with family. Family has a big, big responsibility in my life right now. My grandfather, which has recently gotten very sick very quickly, his responsibilities have fallen on my lap, and it is my priority to take care of him and also take care of myself, which I was declining a little bit, but through support and love from family and friends, I'm here. But in this crazy last couple months, I was losing sleep. I literally thought I had insomnia. I'm like, I have to go get a studies test. I have to know what's going on with my life. Little did I know is that I probably most likely did have a type of insomnia, which I will touch on in this speech. Insomnia is not what people think it is. It is broken up in 3 different parts that I'm going to touch on today. There are definitely more, but it would just be a long speech, and I couldn't get in to talk about all those tonight. We would assume that how can we have insomnia after the busy hustle and bustle of lives that we live? What are the different types is what I'm going to talk about. Who can it affect is another thing. I always thought insomnia just affected older people, people that were just tired, that bodies were worn out, but I was wrong. What can it do to influence our health, our immune system, and will it follow me through my life? Will it stay with me for the rest of my life, or will it go away? These are some of the topics that I will touch on in this speech. First, let's talk about how many different insomnias there are. Like I said, there are multiple ones. Moderate is one of the first areas that we will talk about. Then we'll talk about long-term, and then lastly, short-term. According to the National Sleep Foundation, there's acute, chronic, and transient insomnia. Acute, which is our moderate, is a brief episode that can be caused by a change of life. Changing of job, bad news, losing a loved one, moving to a different house, different state. Anything that is an elaborate kind of change may bring on acute insomnia. Now, this insomnia won't last more than 30 days, and if it does, it will fall into the next category, which we'll talk about in a minute. Acute insomnia will go away, but if not, it'll turn into chronic insomnia. This type may interfere with one's social life. From the lack of sleep, people get cranky, irritable, moody. Some may not even notice that they have a change or that there was a change in their sleep pattern, because this has been their night to night schedule of no sleep for the past couple months. If it hasn't subsided or if been diagnosed, it will definitely be categorized as a chronic insomnia. Chronic insomnia, although is treated, and if you're not wanting to take medicine or you're totally against any kind of herbal supplement, I would recommend, after doing a little bit of research, that meditation, alone time, just at least 30 minutes by yourself, put everything aside, turn off your phone, and just sit and think about how awesome you're doing. That look how far you've come. Definitely just calm yourself down before going to bed, because I've noticed with my day, I go, and then I don't stop to rest, and by the time my head hits the pillow, I'm mentally overly exhausted that I can't even go to sleep. All I'm doing is thinking about the schoolwork that I have to get done, how long I have to be at work, what papers are due, what family member is coming over, who do I have to take care of. And I've learned that I have to delegate my problems to other people so I can focus on me and that my health doesn't fall away and I don't stay focused. Chronic insomnia is considered to be prolonged through the life, if not controlled or medical attention isn't sought. It does, however, increase aging faster, and it interferes with our sleep, because if we're not resting and our body is not giving the chance to rejuvenate itself, we're gonna look tired, we're gonna look ill, and it may bring on wrinkles, premature aging. Although it does reduce our production of melatonin and cortisol, which are natural sleep aids that our body produces in the endocrine system as a hormone. Muscle fatigue and body weakness can aid in this insomnia. As you would know, anytime that your body hurts, you have a hard time falling asleep or staying asleep because the pain is either excruciating or you just can't get over it and you don't want to take any more medication. Hallucinations may happen from the lack of sleep. We may see things, we may hear things. I personally have not gone through any of this. For severe situations, it may cause serious health concerns that your loved ones or family may be concerned and persist that you go get some help, maybe go do a sleep study so they can understand what's going on. Chronic insomnia, like I said, is highly recommended to get treated, not only for yourself, but for the others that may be affected. Like I said, your family, your husband, your wife, your daughter, your son, anyone that's around you, your coworkers. Your coworkers are around you more than anybody, and if you guys aren't getting along, your day is just not gonna go well, especially if you work side by side with someone like I do. The last area of insomnia that I wanted to touch on is transient insomnia. It is a short-term insomnia. Even though it's the last one I am talking about, it is not your most severe area of sleepless nights. This type of insomnia is usually left untreated. Some may not even notice they have it. That could definitely be concerning. But for myself, I felt like I fell into this category. It's short. It only lasts for, at the most, a week. It does bring a type of brain fog, though, to your life where you feel disoriented and confused, or you can't remember why you walked into a room. You can't remember why you opened the fridge door. There's so much going on around you. You have to step back and actually think, what am I doing? Why am I here? Do I have time to do this? Because that's another thing that myself, and I can assume that others fall into, is that we want to start something, but we don't have enough time, so we push it back and back. And then when it is time for our body to rest, we're like, all right, this is our only time. We got to pull a whole all-nighter. and then we regret it the next day when we have to do our 12 or 14-hour day all over again. If it lasts more than a week, it can fall into a category of acute insomnia, which I said only lasts like around 30 days at the most. This type of insomnia, transient insomnia, is brought on by environmental changes. We don't think about environmental changes affecting our sleep patterns or the amount of sleep we do get. Flying, traveling, jet lag. I never experienced jet lag until this last year, and I definitely realized that it does make you so tired. It makes you just want to just go, let's put my vacation on pause. I need to sleep a couple hours, because if not, I'm going to be the worst person ever and you're not going to enjoy me. Definitely learned that the hard way. Time zone changes. We just went through one. Our fall time, when we lost that hour, it's 6 o'clock and it's dark. So the first couple weeks, I was tired by like 9 o'clock, thinking that it was like 11 or 12, my normal time that I would usually try to go to bed. And so the first week, I definitely was adjusting to these time changes and waking up with it bright and coming home from work when it was dark. As teens, we don't realize what it's like to definitely get a full 6 to 8 hours of sleep as they would recommend. I don't really think I get 6 to 8 hours of sleep anymore. It definitely would be nice. Right now is flu season. This is another area that may bring on this transient insomnia illness. Our immune system is low because we are not sleeping. And so this way, with the changing of times, the seasons changing, the weather, we have all these negative things coming at us that we can get sick, and we most likely do get sick from the lack of sleep, no energy. Our body's trying to push through our day, but it doesn't have enough immunity to fight off the infection or the bacteria that is in our body. So, like I said, immunity can definitely bring on this type of insomnia. Everyone says, drink vitamin C, it'll help you. It does definitely keep your immune system up. It'll definitely help you in the long run. There are more areas of insomnia that I could cover and would love to touch on my speech, but there are so many that I wouldn't have enough time, or you guys would be sitting here watching this video for a long time. But one that I did want to touch on is people that have sleep apnea. This is a huge thing. People that are overweight have a very, very, very hard time sleeping, and they don't know why. And it's because our body is always functioning, and it's always working, that when we do rest, it needs that time to rest. Our body needs to rest the same as we do. And when we have the extra weight on us, it has a hard time resting because our blood is pumping more, our heart is pumping more, everything is a little bit more than it usually would be. So definitely get out there and exercise, keep your immunity high. These things we would feel would make us more tired, but they actually increase our energy levels and make us happier, more pleasant people to be around, I guess I could say. With working around people, I definitely have to make sure that I get enough sleep, and if I don't, bear through that one day, because there's always another day to sleep. In conclusion, acute, chronic, and transient insomnia can cause sleepless nights for many, not just ones that may be stressed or overworked. Given the time we live in and what is expected of us from our day-to-day tasks, they can become overwhelming to achieve. But remember to pay attention to what is going on with our body and take care of them. Like I said, immunity, exercise, eat right. Our diet also has a huge effect on the way our body functions, how calm we feel, if we feel irritable or bloated. These all come in contact with my personal life. The severity of acute, chronic, and transient insomnia is subject to other individuals' opinions or their own lifestyle. One person with acute case of insomnia may be only getting 3 to 4 hours of sleep per night, whereas a person with chronic insomnia may be getting their 7-8 hours of sleep, but are waking up more tired than how they felt when they went to sleep. It differs with every other person because not one body is the same. Yes, our body functions all the same, but as people, we're not. Some are bigger, some are smaller, some have a higher energy level, some have a faster metabolism. Our bodies are always different, so we can't compare ourselves to other people, and we can't push ourselves to do the same that other people do. My main focus, though, is that you guys understand what insomnia is, and that it's just not one basic category of a sleepless night. That there are many factors that come into having insomnia, and I hope that none of you are experiencing this, but if you are, definitely focus, find what your problem area is, take that time to have your quiet time and your me time, and put everything aside for a couple minutes, maybe an hour, and just focus on what you have to do, and be positive and be blessed. And I hope that you all enjoyed this video. Thank you.